Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with sexual ailments, starting with the letter S. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, ears, eyes, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, ailments specific to women and specific to men, then issues of the hormones and metabolism. After that, I'll address issues of homeopathic remedies on infections, infestations, and the immune system, and issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum beer people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reaction to the environment, intellectual and emotional features, and general attitude towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with sexual ailments, starting with the letter S. Erection, orgasm, and ejaculation are reflexes, but there's nothing automatic about them. They can be helped or hindered by thoughts and emotions, and they can be helped by trust, relaxation, and fantasy. Guilt, sexual taboos, and fear of inadequacy can hinder them, even when all the right sexual stimuli are there. Even when all the nerves, blood vessel, glands, and hormones involved in sexual response are perfectly normal, male orgasm is a more reliable response than female orgasm, at least during intercourse. However, during masturbation, both sexes' capacity for orgasm is about equal. Like every other part of the body, the genitals are susceptible to infection, especially sexually transmitted infection. There are specific homeopathic remedies for such ailments, but in these days of global travel and high mobility, the giving of antibiotics for some of these conditions, I feel, is justified on medical and social grounds. However, a susceptibility to sexually transmitted infections indicates an underlying miasma that constitutional treatment may help to dispel. Sexually transmitted diseases, STDs, are diseases whose main means of transfer is through sexual intercourse. Gonorrhea. Gonorrhea, or the clap, is a bacterial infection that is spread by oral, vaginal, or anal intercourse with a person who is incubating the infection or already has symptoms. The incubation period is 3 to 5 days, followed by discomfort when urinating and increasingly thick and copious discharge of pus from the tip of the penis in men. Occasionally, however, men have no symptoms. In women, there may be no obvious symptoms or unusual discharge from the vagina. If the rectum is infected, there may be a feeling of wetness inside the rectum or pus in the feces. After oral intercourse, the throat may feel sore. If unchecked, the infection can spread, causing rashes and joint problems, pelvic infection, or stricture of the urethra. If gonorrhea is suspected, see your doctor immediately. If diagnosis is positive, take penicillin or other antibiotics offered. Refrain from intercourse until you are symptom-free, then seek constitutional homeopathic treatment in order to boost the resistance to further infection. There are specific remedies for treating gonorrhea, but these should only be tried if you absolutely have no access to antibiotics. Specific remedies to be taken 4 times daily for up to 14 days. For when the urethral inflammation is marked with burning pain in the urethra while urinating, urine also has an offensive smell. In males, thin fluid mixed with a whitish mucus or yellow pus discharge appears from the urethra. There is soreness in the urethra along with this. In females, there's a thick, acrid vaginal discharge with a fishy odor and is prominent. Use Medorrhinum 6C, that's Medorrhinum 6C. Both watery mucus or pus discharge from the urethra in males, burning, smarting pain in the urethra, are marked on urinating. A desire to urinate is almost constant. The male glands is red, swollen, inflamed, along with the above symptoms. Use Cannabis Sativa 6C. For yellow-green discharge from the urethra in males, sometimes the discharge may be blood-stained. Intense pain may be felt while urinating. Itching in the urethra is also marked. Tip of penis may be swollen, red with burning pain. The testicles may also be painful, swollen, and tender. Use Nitric Acid 6C. For swollen, painful testicles, tearing, pressing, sticking pain in the testicles. Pain is worst on sitting and better for motion. The testicle may also feel hard and are painful to touch. Thin discharge from the urethra may be present. Use Rhododendron 6C. Painful burning urination that is worse while urinating. Pain in the urethra is very severe, cutting and sharp in nature. The desire to pass urine is also frequent. Urging to urinate is most marked while standing or walking. Urine may be scanty or sometimes passes in drops. Painful urination is worse at nighttime. Use Cantharis 6C. For increased frequency and urgency to urinate, the frequency to urinate is very high and the person has to go almost every hour. While urinating, burning and biting pains are felt. In males, thick green or yellow discharge from the urethra may be present along with the above symptoms. In females, greenish vaginal discharges with burning and itching may be there with high frequency and urgency of urination. Use Merck Sol 6C. Females with white-colored vaginal discharge like milk. The discharge is acrid, thin, with marked burning in the vagina. The discharge may also cause biting, stinging pains. The discharge is most worse on lying down. Use Pulsatilla 6C. For females with greenish vaginal discharges, the discharge is profuse, mainly after urinating. The discharges cause itching of the vulva and vagina, along with burning pain. Pain and bearing down sensation in the pelvic region is marked. painful intercourse in females, and bleeding from the vagina after intercourse. Use Sepia 6C. Females with yellow vaginal discharge that are acrid and corrosive in nature, causing much itching. The odor is also offensive. The vaginal discharge is attended with fatigue and weakness, especially in the legs. There is frequent desire to urinate. Use Kreosote 6C. In females, painful intercourse and a burning in the vagina during intercourse. Profuse vaginal discharge along with weakness may be present. The discharges are acrid and may be greenish or transparent, watery, that causes itching, especially at night. Use Natrum 6C. In females with heavy periods, the bleeding is profuse, bright red colored, and is mixed with dark clots. The least motion increases the flow of blood. Pain from the sacrum to pubis is a characteristic. Use Sabina 6C. Also, you can use Gonorrhea Nosode 30C and 200C potencies. Herpes. Herpes is caused by the same type of virus that causes cold sores around the mouth, transmitted by oral genital or genital-genital contact with someone who is incubating the virus, who already has symptoms. Virus incubates for about 10 days, then causes itchiness and crop of small blisters on the penis or vulva. These quickly become moist and ulcerated. The glands in the man in the groin become swollen and tender, and the slightest fever develops. Symptoms usually clear up after 2 weeks, but for 50% of sufferers, the virus lodges in bundles of nerve cells at the base of the spine and causes further attacks. Milder and less frequent. Whenever health is below par, herpes can be fatal to babies. So if infection is active at time of birth, the baby will have to be delivered by cesarean section. Constitutional homeopathic treatment may help to prevent recurrence. Specific remedies to be taken 4 times daily for up to 14 days. Bad ulcers that bleed, especially at night. The whole genitals are very tender and painful. Use Sempervivum 6C. Skin of genitals very dry, lesions hot and puffy with pear-like blisters. Use Natrum 6C. Genitals burn and itch, discomfort aggravated by cold or damp, general restlessness. Use Rhus 6C. Genitals burn and sting, skin cracked and with red, itchy rash. Use Capsicum 6C. And you can also use Herpes Progenitalis Nosode 30C and 200C potency. Self-help. Avoid intercourse during an attack, or if you feel tingly or tenderness that heralds an attack. Always wash your hands with soap and water after touching ulcers, and expose ulcers to air as much as possible. Ulcers can be bathed in hypercarium and calendula solution. 5 drops of the mother tincture of each to a half a pint of boiled and cooled water, 4 times a day, or calendula ointment can be applied. Frequent warm baths with salt added to the water are soothing and speed healing. NonSpecific Urethritis, NSU, is an infection and inflammation of the urethra due in 45% of cases to organisms called chlamydia, which are halfway between a virus and a bacteria. In other cases, cause of infection cannot be pinpointed. 3/4 of sufferers are men. Infection is usually not invariably spread through sexual contact and may take 1 to 5 weeks to incubate. In men, the first sign is a tingling sensation at the tip of the penis, especially after urinating first thing in the morning. This is followed by a clear discharge of the penis, scanty at first, then thicker and heavier. In women, there may be no symptoms at all, or slightly increased discharge from the vagina. If the infection is suspected, see your doctor and take the antibiotics prescribed, and do not have intercourse until the entire course of antibiotics is finished and you are symptoms-free. Your partner should take antibiotics too, even if he or she has no symptoms. Constitutional homeopathic treatment is recommended after the full course of antibiotics is finished. Pubic lice or crabs. Pubic lice or crabs are a crab-shaped species of louse, about 1/10 of an inch long, that lives in pubic hair and in hairs around the anus, sucking blood and causing itching, especially at night. Adult lice move from one body to another during sexual contact, but symptoms of infestation may take several weeks to appear because eggs, the nits, laid by adults take a week or 2 to hatch. If pubic lice are suspected, see your doctor. A special cream or ointment will be prescribed to kill the lice, and you may be advised to shave the pubic area to get rid of nits, which cannot be removed by normal washing. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.